Good afternoon. Welcome to the Kentucky Area Health Education Center presentation. My name is Juliana McGuinn, and I am the director for the North Central AHEC. We are located in Florence, and our host institution is Gateway Community and Technical College. I am going to let my colleagues to introduce themselves.
I think I'll stay seated, Juliana. My name is Kelly Owens. I'm the Center Director for the Southern Kentucky Area Health Education Center. We cover 15 counties in the southern region of the state, beginning our northernmost county being Madison, and if you follow that I-75 corridor all the way down to the Tennessee line. Our host institution is Rockcastle Regional Hospital.
Awesome. My name is Catherine Malin, and I'm the Center Director for the South Central AHEC. We are hosted at Western Kentucky University in Bowling Green, and we cover 22 counties along the I-65 corridor from the Tennessee border up to Hardin County and then east.
I am Missy Stokes, and I'm with the Purchase Area Health Education Center out of Murray, and we are our host institution is Murray State University. We cover 12 counties, Line, Livingston, and Trigg, and everything west, so we're in the farthest most western part of the state.
Good afternoon, Michael Gayheart. I am the director of the Southeast Kentucky Area Health Education Center. My office is located in Hazard, Kentucky. We work in 16 counties in southeast Kentucky. It covers everything up from Martin County, south down to Bell County, going west over to Clay County, up Owsley and Lee, and pretty much everything in between. Just the opposite of Missy. We're on the other side of the state, and just very happy to be here today.
Okay, thank you. So today we will be talking about our funding journey with the state. And like Mike said, David is not here today, so Kelly and I are helping out with the presentation, so thank you. So the Area Health Education Centers were created by Congress in 1970s to enhance access to quality health care. The Kentucky AHECs began in 1980s. We strive to enhance the healthcare system through healthcare pipeline activities, which we'll talk about it in a little bit. Before we talk about the pipeline approach, I want to share with you where we are located across the state. There are 8 AHEC centers hosted by local institutions and 2 program offices. Our program offices are at U of L and UK College of Medicine. I want to refer back to this slide here. Despite being in different areas, we'll have the same goal: get rural and underserved students into the health field, knowing that these students are more likely to return home after training and practice in the rural and underserved communities. With healthcare being a very stable career, this is not only benefiting the community, but also the student. We do this through a pipeline of programs beginning in middle and high school. So this chart here shows us how we receive the state funding. It usually comes right now through the cabinet, and then the state funds go through the University of Louisville School of Medicine, and then on the eastern side it goes to University of Kentucky College of Medicine, and from there it goes to each one of the 4 centers. Okay, so we have found great opportunities. We have been in good crisis mode, and so we are seeking funding, and we have re-engaged with our state and legislators and representatives. Now I would like to pass it on to Kelly to talk about this part.
All right. I had planned on sitting at this desk the whole time, so pardon me here for a moment. So with several years of funding cuts and from the universities and other forms of funding that we had, coupled with what happened in 2020, we've really had shown that there was a big need, a big need for our services. And we all are here today talking about those workforce healthcare shortages and what can we do about them. So we have decided that there are a lot of folks around the state who are trying to address some of the same issues as we do here at the AHEC. So we've really began meeting and discussing and re-engaging with partners that we had already had for some time. And you can see a list of some of those entities here. And also there at the bottom are state legislators as well. Now, many of us have had working relationships with our legislators over the years. I've had one serve on our advisory board for several years. And just keeping them abreast of what is going on in the community, what we are doing to assist the already existing providers, and what some of those gaps in services and needs are. And then working with our school systems to help influence students and give them the tools that they need to reach their goals of being in the healthcare field. So with this, we decided in order to do this, we're going to need more funding to reach the underserved rural students in our region. So we've been in conversations with some folks at the Department of Public Health, and then also talking with some contacts with the governor's office and in House and in legislature in order to get some funding to be able to address these needs in our area. Someone else have this one? So part of the strategy for this is going and meeting in Frankfort. So one of our partners that we've had for many years is Kentucky Rural Health Association. And many of us had already attended their legislative days in the past, so we brought some groups of students with us who had benefited from our programming to just really show what the AHECs can do for them. And you're next. Yeah, they are. There you
go. All right. We've got our slides down. What have we done? And I'm going to talk about the nuts and bolts of trying to get boots on the ground, programs implemented throughout the state to enhance the workforce shortages and for AHEC, Kentucky AHEC, to make an impact. That's what we have been charged with, and that's what we said we would do, and here are the things that we have implemented. We, as a state program, we've created nursing pipeline programs. You can see in the southeast part of the state, in my region, we've coined the phrase MP Squares, stands for Nursing Pipeline. I'll talk more in depth about that program shortly. Southern AHEC has a Next Nurse program. You can see other programs here. Northeast, as well as Purchase, has a charge program. North Central AHEC called Gap to Gowns. Essentially, we're working with high school students that have an interest in the nursing field. And so we'll get in depth of this program here shortly. Another thing that we have done is expand our STEPS program. And when I say STEPS, it stands for Successfully Training and Educating Pre-Medical Students. So we identify college juniors that are pre-med students that want to be admitted into medical school, and we put them through our program. And what this program does, it offers a MCAT prep course for these students. The students have buy-in on this program. So we pay a portion of this MCAT prep course. The students pay a smaller portion. but they're invested. And so it gives them more motivation to really take it seriously and to advance their skills. We also set them up with job shadowing, and that is critical as it needs to be on their applications and their resumes. Personal statement development is so critical for medical school admission. And so we have a professional group that we contract through the National AHEC organization that works directly with these pre-med students to develop and fine-tune this personal statement over several months of time. And so they feel really comfortable and confident by the time they're finished with this process. In addition to that, we also go through mock interviews with these students, and essentially we're working on their level of confidence. And so when they get that call, after they've applied to medical school, they get the call to come in and interview, they're a little bit more comfortable in doing so. And so all of these things that we do really enhances their ability to be admitted into a medical school program. Other things that we've done with our funding increase, we've expanded our summer health career camps. And I'm talking throughout the state when I mention these things. Specifically in Southeast Kentucky, we have been doing health career camps for years, several years. And we have been able to expand specifically in our region, as well as all the other AHECs in their regions as well. We've expanded our classroom presentations, and that you'll find that essentially it enhances some of their knowledge base, the STEM areas. It provides supplemental education to these students, and just essentially gets them more interested in a health career. We offer expos throughout the state, and these expos, again, just exposes and gets them more curious about what a career in healthcare looks like. And then last but least, the health career exploratory clubs, whether it be in school or after school, we will work with several high schools throughout the state and identify these students that want to be in these clubs, and essentially we target programming for them to expand their interest. And we'll set up things such as job shadowing, and we'll do a lot of hands-on activities just for these high school clubs. So let's talk about the expansion of nursing pathways. Yesterday, CEP provided a workforce development conference. Identified in that conference, by 2024, Kentucky will have a shortfall of 16,000 nurses. That is staggering. In addition to that, there's almost a 25% turnover rate in healthcare. Staggering. So what can we do as a Kentucky AHEC program to offset this need, or be a part of the solution to offset this need? So at Southeast Kentucky AHEC, we identified what we called the Nursing Pipeline Program. In-house, we call it MP Squared. And the purpose is to guide and assist students that have identified an interest in nursing to successfully pursue their chosen career path by enhancing the student's ability to be admitted into a nursing program coming out of high school. That is our goal. So you'll see in the picture, this is one of our students from last year's cohort with a mentor. And that individual was able to spend some time in a hospital with a practicing nurse. So the structure of this program essentially allows for students to get experiential and didactic training, much like another program that we have, what we call AHEC Scholars. We, at Southeast Kentucky AHEC, we partnered with Appalachian Regional Healthcare and 3 of the KCTCS nursing programs. One is Southeast Kentucky Community and Technical College, one is Hazard Community and Technical College, and the last but not least is Big Sandy Community and Technical College. And we brought all these individuals to the table and we discussed the importance of this pipeline program. And so with that said, last year we accepted 40 students into our program in Southeast Kentucky. This program, we were able to get students from 14 out of our 16 counties. We had approximately 80 applications. This year, actually yesterday was the first meeting that my staff had with our second cohort. We admitted 50 students into this program. However, we had over 150 applications, and we admitted students from all 16 counties in Southeast Kentucky. That tells you the need, that tells you the interest, and it really excites me that I think we're on the right path. So with that said, what do we do with these students? How is it structured? Well, like I said in this picture, the student is paired with a practicing RN. So Appalachian Regional Healthcare has said we will provide the mentors. And that is so important. So we have brought the workforce community into this program to provide practicing nurses to mentor these students. Now, what does that mean? They'll go in for job shadowing. They will receive guidance on their career, the do's and don'ts, as well as how to navigate through the nursing program. So that's a very, very important part of this process. In addition to that, we have monthly Zoom meetings with our students. These Zoom meetings will cover such topics as scholarship opportunities. We'll have KIA to participate, as well as local organizations that provide scholarships to these students so that they know they can access the ability to attend college. And that is also vitally important for these students because that builds confidence. We have a lot of first-generation students that go, that want to go to college. We have a lot of students that have been raised by grandparents. It's not easy. And so some of these students, even though they have the ability, they're very academically prepared, they're very smart, but the confidence sometimes lacks behind those other academic preparation skills that they do have. So bringing that to the table is a plus. Another Zoom meeting is that we have these KCTCS nursing programs to participate in our Zoom meeting and talk about the pre-admission requirements. For those of you that have kids, or had kids go through high school and taking dual credit, it can be confusing. What do I take? What should I not take? We want to make sure that they understand the pre-admission requirements so that they're not taking unnecessary classwork. They're taking the right classes to be ready to apply for admission straight out of high school. So we bring those nursing programs to the table. We want them to also understand it's a competitive process. If it was easy, everyone would do it. It's not easy. It's a competitive process. So they need to understand that. They need to understand they need to have their academic abilities in check. They need to understand that they have to job shadow. They need to understand what builds their application. And so the KCTCS programs do that. Also, another big part of this process are the entrance exams. And that was a little bit eye-opening to me. When we look at one program, they may require an ACT score. Another program may say, we don't require the ACT score, we require a PACS entrance exam score. And then a third may say, we don't require either, we require a TEAS entrance exam score. And that can be very, very confusing to students. It was confusing to me to start with, and I know it's confusing to them. So what we've done there is we've identified where they're from, which school they want to go to, and we provide them a study guide based upon the requirement of that particular program. Another Zoom meeting that we have focuses on mental health and self-care. Vitally, vitally important. It's vitally important for all of us. So why would it not be vitally important for a teenager, a high school junior or senior? This program talks about basically taking time for yourself, getting adequate sleep, things such as the Blu-ray lights and how that the blue light does not allow your brain to shut off, and therefore you can't sleep. Small things that we overlook, things such as stress management, very, very important to a teenager. Times have changed, and these teenagers are encountering things that we really don't know or don't realize that they encounter. Resume writing, we focus on that. Why is that important? Well, because it's a competitive process. It's unbelievable how many programs we have and how many applications we have, but students fail to take credit for things they've accomplished. Things that we know they've done, but they still don't write it down. They don't put it on the application. Either they've not taken the time, they've forgot, whatever it may be, they failed to do that. So we have a course on resume writing and the importance of basically claiming credit for all of their accomplishments. Whether it be academic, employment, community service, doesn't matter. And we talk about how to package that professionally in a resume. And then the last Zoom program that we do is mock interview and basically interview skills. And we want them to walk away just being a little bit more confident in their ability to communicate, whether it's in a small group, a large group, does not matter. It's very, very important. So those are going on each and every month through the academic year. Then one time in the spring, we'll bring all, last year was 40, this year will be 50, bring all these students together to a one-day symposium. And these students will get to meet each other. They'll learn more about local scholarship opportunities. They will get to sit down and talk to the KCTCS nursing programs. They will, if they're ready at that time, they'll get an opportunity to go ahead and apply to those nursing programs. That's what we want. Also, in this in-person event, we have programs over time management, how to study, and Professionalism 101. So we break that day out so that they're getting the didactic as well as the hands-on opportunity, face-to-face communication with these nursing programs and the healthcare partners that we have that day. So wrapping up this program, what does the students receive? Well, we, Southeast Kentucky AHEC, we provide them with a $100 stipend. ARH matches that stipend, so they're going away with $200. They have that mentor relationship. They have direct connection to nursing programs, vitally important. Scholarship availability, all the didactic and experiential training that they've received throughout the year. We also provide them a nursing school bundle, which is an academic planner and study guide for them to use once they're admitted to the nursing program, with little flashcards for studying. Very, very nice bundle. And that is put together by a company called Nurse in the Making. So if you're interested in that, you can look that up. And then, like I said, we also provide them with an entrance exam study guide, whether it be TEAS or the PACS exam. So that is our nursing pipeline program at Southeast Kentucky AHEC. And like I said, you will see other nursing pipeline programs throughout the state that is trying to make an impact on our nursing shortage. Expansion of health careers expos. We all do this throughout the state. We provide these exploratory, hands-on, fun activities for high school students to come to. The challenge that we see is that the high schools need money for buses, or they can't hire bus drivers. There's a huge shortage of bus drivers. So trying to get them there can be a challenge. And so, it's not like Field of Dreams always. If you build it, they'll come. Essentially, you have to go to them. And all of my counterparts do these expos throughout the state. In the picture, you'll see a large inflatable mega body that was purchased by Southern Kentucky AHEC, and they've used that at their expos. And Southern Kentucky and my AHEC Southeast partnered just recently in Clay County on a large expo, and we were able to exhibit the mega body to the students in several counties. And so they get very excited with these things. We have the inflatable lungs and the colons that are broad, and so the mega body was just a nice addition. But like I said, you have to go to where the students are. So this year, for example, in my region, we have hosted one in Harlan County already, and we have completed the one in Clay County. We will be doing an expo in November in Johnson County, and then in the spring we're going to host one in Perry County. And so again, we're in 16 counties. We can't do 16 of them, but this helps the schools to be able to drive shorter time frames and to bring their students.
Earlier, Senator Meredith asked us all if we wanted to who would raise their hand, thinking that they were paid what they deserve to be paid in their job. Well, if you're in healthcare, I don't think any of us would agree we're in it for the money. I think we're in it because we are all passionate to help people, and healthcare workers are there to help people. And I'm very passionate about getting students interested into healthcare. You can't hear me? Oh, I'm sorry. Apologize. I'm really passionate about helping students get into healthcare, and that's where expansion of our high school classroom programming comes into play. We've been doing classroom programming for years across the state, but with the extra funding that we had, or the extra funding we had, has enabled the AHECs to enter the classroom across the state and engage high school students in health careers. For example, South Central AHEC has expanded their future healthcare professionals program from 2 counties to 14 counties, with more counties being reached this past year. Their FHP meets every week for the entire semester. Another example of that is the Purchase AHEC, which is our AHEC office. We do a very similar classroom presentations as South Central does, and we cover 12 counties, and out of those 12 counties, we were in 9 of the 12 counties prior to the expanded funding. Well, we have 20 schools in those 12 counties, and we now are in 17 of the 20 schools, and we are in all 12 of our counties. We are also in Caldwell County, which is in the West AHEC region, and the reason being we're in that county is because Lyon, Trigg, and Livingston students, Lyon, Trigg, and Crittenden students, they all attend Caldwell's health science program that they offer at their high school because they don't have it at their high school. So with them being at Caldwell, we sent our health career coordinator to participate in classroom presentations. So now we have reached all of our counties, and we have extended that into Caldwell as well, even though I guess West AHEC is in Caldwell County doing presentations. I don't think they work with that specific classroom that has our students in it, so we have been able to reach those over this past year. So the results from fiscal year 23, you can see the different programs and how many students we have had, we have reached over the year. Academic prep programs, which is a lot what Mike was talking about with our MCAT prep programs, 134 students. Health career expos and fairs, 8,912 students. Classroom and health education presentations, 13,073 students were reached. Longitudinal health career clubs, and longitudinal health career clubs are, they can include classroom presentations that you're seeing the same students over a period of time. So like Catherine in South Central AHEC, they have the FHP program, which would be like a club because they see them weekly for the entire semester. We have reached 13,000 students. 914 students with the longitudinal health career clubs. Clinical, experiential, and shadowing, 517 students. Exploration field trips, 244 students. And health career summer camps, 294 students. That totals 24,088 students. That is 12,000, and I think it's 12,077 more students than we reached before our expanded funding. Some of the programs I wanted to talk about I'm going to back up on this results from some of the programs are the MCAT Prep, Student Rural Health Association. That's one of our main programs at Murray State. We have Murray State Student Rural Health Association students, and we went from 2 students to start with to 8, and then this year we have over 24 students in that program. Letters from Home, it's a program we do with medical students that are from UK, U of L, the UK Bowling Green and the U of L Madisonville Trover Clinic, we host dinners with them once a month, and those are students that are from our area. We have dinners with them from first year to fourth year. We take hospital recruiters with us from our area so that they make that contact with those students. Matter of fact, we just piggybacked on this conference and did a U of L dinner Monday night and then a UK dinner last night. And I think we had a total of 24 students. I think we had, or 34, sorry, 17 at one and 17 at the other. And so that helps us reach those kids that are from our 12-county area, keep them in touch with what's going on back home, what's going on with the hospitals, because hospitals will start talking to them when they're in first year. This is not basketball or football where they can't recruit you until you're a senior, a junior or senior. They can start recruiting you at first year. They just can't, a lot of times, sign you. We do a journey home as well, and we host those in our own hometown, and that is for the students that are actually in our hometown doing their rotations from the colleges, which it could be pharmacy students, physical therapy students, dental students, medical students, you name it. If they're in our area doing a rotation that month, we are going to take them to dinner with usually our chair of our board so that we can kind of keep in touch with them as well. We do a HPI, and that is across the state, and that's a health professions investigator program with high school students. Rural community health scholars, that is with pre-med students, and we hold that in the summer, as well as we have our charge program that Mike talked about with the pre-nursing. It's pre-nursing and then for high school students, and then we also have a summer charge program for pre-nursing college students. So we're reaching them in high school. It's one level, and then you go to level 2 when you get into college, and that's with Murray State and West Kentucky Community and Technical College students. We also do a health professions program. We do a lot of programs. So, and I can go on about all of these. We do a dental clinic, and it's a free dental clinic that's offered in our area that we work with the University of Louisville Dental School, and we offer free dental care for kids that do not have insurance or that can't afford to go to the dentist. And I just got an email right before we came up here from Paducah Public Schools, and they have 22 kids that are in desperate need of dental care. I only have 20 spots. We do it once a month. I have 20 spots each month, so if we don't get them this month, we will get them in next month. But that affects kids' learning. If they're in pain and they're sitting in a classroom, they're not paying attention, or they're going to miss school because they have an abscess too. So we are trying to help better the kids' health in the school so that they can actually be at school to learn. And then we do clinical placements, and I believe that's all on those results. So the 24,088 students, and you can see there some of the activities that we've done with those students. I'm not sure what that is in that middle picture. Is it of what? It's not? Okay. They're dissecting something, but I can't tell what it is. So it's not one of ours. It's someone in our AHEC that's dissecting something. Sorry about that. So talking about the 24,000 students that we've reached, that is an investment of $103.78 per student. That's not a lot, okay? And that is with the money that the $2.5 million that AHEC received. That's $103.78 for the 24,088 students that we have served this past year. 12,700 additional students were reached with this new funding. Number of Kentucky counties served went from 25 to 85. And you'll see a map in a minute that's used to be a lot of white, and it's colored purple, a lot of purple. And I don't know if anybody said that yet, but when you take U of L red and UK blue, it makes purple. So that's what we went with. Why we went with purple. Our state logo for Kentucky AHEC is purple. So we did agree on something. 81% of the students indicated increased confidence in achieving a future in health professions after participating in an AHEC program. So this is our entire state, and this was fiscal year 23, and the white counties are the counties that had not been reached with the additional funding. But now I know we are making waves to turn all of those purple. I know I'm in Western Kentucky, and you can see that Lyon and Caldwell are not purple. They are now. That's just since June that we started working. When the school started in August, we started working in Caldwell County in line with the Lyon County students as well. I believe Catherine's up.
All right, thank you. So we've been up to a lot. We've been busy in fiscal year 23. So just to do a brief recap, right? We wanted more additional funding. We wanted to other people to realize the shortage of healthcare professionals. We acted upon that, and we want to do our part to help in that. So with the $2.5 million we got each year, we've expanded all these programs. Well, you guys know, as well as we do, that it takes more than just 2 years of funding to solve our entire healthcare shortage, right? It's going to take decades. We have to work through the pathway. We have to work with these students. You know, our students who are in high school, who are freshmen in high school, they're not going to graduate residency next year, right? We have to work with them through high school, through post-secondary programs, and then beyond. So really, we're looking at a long-term investment. And so when we got this additional funding, we immediately knew we had to come up with a strategy to, one, measure our success, and two, tell our story. And so that's what I'm going to talk about, because we knew that both of those factors were very important in ensuring that we can make this a long-term investment. We can continue to work with that student that we met with last year, who's a freshman in high school. We can still be working with them for 8, 10 years until they get that placement in the hospital. So I'm going to talk about the strategy we formed. The first one, Missy stole my thunder, but was developing a statewide approach, right? So combining the U of L red with the UK blue to make the Kentucky AHEC purple that we are now. So you will see one of the first things we did was develop our Kentucky AHEC logo, which you've seen on all these slides. The next thing we did was we had to come up with a way of measuring our success. We have been around for decades, but we have never collectively as a state collected the same type of data. So it made it very hard when we were reaching out to legislators, reaching out for other grants, when they said, as a state, tell us about your success. Well, here in one region, we can tell you that, 80% students strongly agreed. That region used a 5-point Gayheart scale. Well, over here, they actually used a yes, no, and maybe scale. There was no way for us to collectively combine this data that we had collected over the years. So we stopped right there, and we developed a data collection tool that we use now across the state. And so throughout this entire process, we were constantly evaluating what we did too, right? Not just what the students thought of our programs, but what we were doing. We were evaluating our process. And we've had to make changes from that. So originally at the beginning of fiscal year 23, we had one data collection tool for all of our programs. Well, you guys heard the long list of programs that Mike and Missy said that we've done. One collection tool didn't really work. It didn't really work for a freshman in high school who is meeting with us for a one-time event on one field trip at a health career expo where they're with us for 2 hours, versus a student who's with us for the entire summer, a 3-week-long summer camp where they're spending the night. The quality of programming is different, right? From 2 hours to whatever, 80, 100 hours that the student is with us. So we regrouped. We realized that we need to adapt again, and then we've adapted. So now we're collecting data across the state that's uniform. And this may sound super basic, but when we were operating as 8 different entities, we didn't have even that basic level of data collection. So we're collecting data, which we can then, now when someone asks us, what percentage of your students benefited from or thought that they felt more prepared for entering a health career, we can answer collectively as a state. And so just a couple of the questions that we ask on these, in addition to basic demographic questions and how we can improve our programs, are things like, as a result of this program, has your interest in pursuing a health career increased, decreased, remain the same? Another type of question, do you feel, how has your confidence level changed based on this program for entering a health career? And then with our post-secondary programs, what is your intent to stay in Kentucky? Because while it's great to train and make new health professionals, it's even better for them to stay in Kentucky. So we're now collecting statewide data, and then we're also now tracking students over the long run. Again, we talked about that freshman, right? I can't tell someone if they have entered the healthcare field for another 8+ years, right? We have to track these students. Now with some of our post-secondary students, for example, our pre-nursing or our nursing students, we have quicker turnaround time. But it was really important for us to track our students over the long haul so that we can see if a student we met with in, let's say, 2023, by the time, 10 years down the road, if they are actually finally practicing as a surgeon in Kentucky. So we developed that tool, and we had something in place, but we were not using it uniformly. So we adapted and are now using it uniformly. So we have the data now, and now we have to do something with the data. And so the other thing that we really wanted to focus on was sharing our success. It used to be that AHEC prided itself on being a little-known secret. We're that little-known secret on the 4th floor away from everyone else that no one knows anything about, but we do a lot of good stuff. We know we do a lot of good stuff, so why do we have to share it? Well, the wake-up call came in this past funding cycle being like, hey, if you don't share your stories, why should anyone care about what you do? And so future success really requires us sharing our current success. So again, we developed a statewide approach to share our success. We do this predominantly for our legislators, but also for anyone who we partner with. And so the main thing was developing quarterly updates that we send out to legislators, to our advisory boards, to any primary partners, and then also being more active on things like social media, sharing our stories on social media. The number of scrollers we have, seeing a photo of high school students, or having one of the schools tag us that we're at, it really does make an impact in sharing our stories. And then we also met with legislators, which I'll talk about in just a bit. So this is just an example of one of the quarterly reports that we send to our legislators. Again, it's uniform. It's adapted for each of the regions. So, for example, this is mine. It says South Central on the top, but we would change that to whatever the center is. So for Southern, and then the top section is unique to each region. This is where we talk about whatever programming we're doing, whatever new initiatives we have. But then the bottom section, we meet collectively as a state to decide what data or what points we want to share with the state legislators about that past quarter. And so it looks uniform, but it's unique to each center. And then some centers even make it even unique to the region or the county specific. So we started sharing our story. We also need to share our story with our legislators, right? We give them the quarterly updates, which are great, but how many of you read every single email you get a day? Okay. Person who works in my office, Emily, apparently reads all the emails she gets a day. And then Jim, who's the program office for AHEC at UK, reads all of his emails. 2 people out of here read their emails a day. We know that our legislators don't read all of their emails they get every day. And so while we would love to assume that they are reading our wonderful quarterly reports that we spend time creating and looking at the beautiful pictures, and while we would love to know that they are actively following us on Twitter and Instagram and following and watching all of our Facebook stories, we know that's probably just not the case, or not 100% the case. So we actually have to go to Frankfurt and talk with our legislators. And when Senator Meredith was talking, he stole what we were going to talk about, because it really does come down to that we had to make those personal relationships. I will admit I had never been to Frankfurt. I'm a Kentucky transplant. I had never been to Frankfurt before this process. And all of a sudden, we're meeting with legislators, we're learning about their children, we are learning about their activities, and we're learning what their passions are. And for a lot of them, their passions are healthcare, and it aligns very well. So we have gone to Frankfurt many, many, many times over the last year, and we would continue to go to Frankfurt over the next years because it is important to share our stories. And sharing the stories and sharing the success is great when we talk about it, but it's been even more influential when we bring our students with us. When we bring the students who've completed our programs, when the students can then talk to the legislators and say, hey, this is what we did in our program, this is why we think it's really cool, and the legislators then all of a sudden listen. So if you're ever in Frankfurt, bring your students with you. It makes a much stronger impact. We've also brought our legislators to our events. So again, while it's super great for us to share on social media and take pictures and share photos, you can't really feel a whole event. You can't really get the whole vibe of an event by just talking about it or seeing pictures about it. So we've started inviting legislators to our events. Hey, why don't you come? You're invited to come to our Career Expo, walk through the mega body with us, see what these high schoolers get to do, learn how to suture with our kids. Come to the closing ceremony of our summer camps. It helps them feel more involved, it helps them feel more engaged, and it also helps them get a better picture of what we are actually doing out in their communities with their citizens, with their community members. So we've been to Frankfurt an awful lot. We continue to be in Frankfurt an awful lot, and we continue to invite our legislators to our events to really share our stories. And then the other thing, this is new for us this past year, is that we actually are starting to share our story with committees, not just with individual legislators, but with the committees that are meeting. And so most recently, we met with the Interjoint Committee on Health Services, and it was conveniently at the State Fair. So some of the center directors got to go and present there. And that's just a collective audience, right? There's people there who are interested in healthcare, they're interested in closing the gap, and we are there to tell them that we're doing that. So a little bit about where we are, where we're going, and how we're going to get there. And I'm going to hand it off to... I'm just going to keep talking. This was definitely David's slide, so we're going to go through this. Okay, so we have, right, FY23 was our first year with funding from the state in a long time. We got $2.5 million per year, which at the state level, that's like a penny. But for AHEC, that was like, oh my goodness, we won the jackpot, right? And we were able to do a lot with that funding. But we weren't able to do enough. Right? We haven't been able to reach all of our counties with it. We haven't been able to reach all of our students. In some counties, we can only be in one classroom. Well, there's way more students than one classroom of students, right? So we haven't been able to reach all of our counties. We haven't been able to reach enough students in each county. And then our length of our programs offered are limited because we have, for example, I have 22 counties. Well, I have 3 health career coordinators, and to divide 22 counties up by 3 and include the time change between Central and Eastern and all the driving time, we just can't be everywhere at once. So we want more funding. Plain and simple, is we need more funding to be able to reach all of our counties, to be able to reach all of our students with the high quality program. So after talking with a lot of the legislators that we've built connections with, seeking their advice, because none of us are like policy people. We're like healthcare, we're like educators, we're like, let's get in the classroom, let's get our hands dirty doing dissection, things like that. After seeking their advice, they gave us the recommendation to ask for an additional $1 million this year. And so that's what we're doing. So even though we just started fiscal year 24, we're already looking towards fiscal year 25 and 26. And so we've requested or asked, begged, plead, I don't know, what do you want to call it, for $3.5 million per year for the next biennial budget. What that will enable us to do as an AHEC is hire at least one additional full-time health career coordinator, which will enable us to do all those things that I previously mentioned. It'll enable us to reach all counties in Kentucky and all counties in Kentucky with high quality, long-term programs. So for example, we're in Hart County right now this semester. I can't be in Hart County next semester because I have to be in Monroe County. But with this additional funding, I'm going to be in Hart County all year, and Monroe County all year, and Hardin, and Simpson, and so on and so forth. It'll also enable us to increase the number of summer programs because we've been, summertime is we have an active audience with the students. And if we can increase those programs, we can engage them in between the semesters and then continue on right when they get back into school. So we're in the process right now of making that known, which is one of the reasons we're here today, making those trips to Frankfort. And then we're also going to host our very first ever Kentucky AHEC Legislative Day, where we bring our students to the Capitol and we have them tell their stories with the legislators, have them talk about our programs, and talk with them and meet their legislators. For them, it'll be a lot of their first times ever going to Frankfort too. So that's going to be on January 9th, 2024. You all are welcome to come. We'd love to have you. And there'll be more information coming on that. Is this one also mine? All right, I think Juliana's going to take this slide. All right, I'm passing it on to Juliana.
Thank you. So I second what Catherine was saying. It's so important to be in contact with the state representatives and legislators and just keep emailing and following up on questions that you may have. In my case, in Northern Kentucky, I have been in contact and conversations with Representative Moser. She has been great with the AHEC, and when you ask her a suggestion on any recommendations, she's always very responsive, as well as Senator McDaniel in Northern Kentucky. He's from Kenton County. He has also been, we met with him in person the first time last year and provided an educational presentation for him about AHECs because he's never heard of the AHEC before. So that was very interesting. We also brought students with us. So these two slides are actually, what I was going to say is that this new state funding through the cabinet has expanded, has given us the opportunity to expand health career programs and other programs that we offer that Missy mentioned. And so it has been a great learning experience for all the AHEC staff and also for other organizations to see the impact that we are having in the state and also the benefits that our programs are giving to the students. So I think that it has been great. We have been able to reach more students. We have been able to reach more counties and build more capacity. So this is one of the programs. Let me get back. This has opened more doors for more funding. So I haven't applied for any other grant opportunities, but we have had organizations reaching out to us or even the Department of Public Health. So I know that for David, for example, he was able to secure the maternal health workforce promotion grant and also the workforce pathways for youth. And in my case, in North Central, we were approached by the Kentucky Office of Community Health Workers. So they asked if we were, we have a very strong program in Northern Kentucky for community health worker training. So Laura Eyrick, the manager for the coach office, provided us this opportunity of engagement and support for CHWs, where we are going to be offering CEUs to community health workers in the state, as well as we are going to provide classes, health education classes that relate to COVID education and also chronic underlying conditions. So we will be planning, designing, and providing these classes in our region, especially in our rural counties when where people cannot get to us, then we will go and to those locations and provide this education. Final comments? Questions?
Absolutely. So we cover all the bases, all the allied health positions. We actually have utilized some of this state funding that we've been granted to provide mental health, train the trainer for one of our staff people. And so they're actually working with students who are involved in some of our programs and also offering the training to our local school systems. But yes, to answer that question, yes. Yes, I see someone in the back.
Do you know how many of your students actually end up in these allied health professions? I know you're going to try to collect that going forward, but do you have any idea at this point?
Oh, Jim may have that.
Jim has his hand up.
Do you need a mic?
You will notice that we have collected longitudinally every student, the information for every student that we've touched since about 2004 to 2005. Unfortunately, we haven't had the manpower to go through that and compare it to my student database. But I have a colleague that I'm working with that maybe can help us do that. I can't say who it is, and she's investigating it, not yet. But and we're Center for Excellence for All. So we should be able to cut down. There's a summer camp that we do that's part of this University of Kentucky. And as of 2018, about 80 to 85% of the students did go to the health program from the
So to summarize for the people over here, Dr. Jim Ballard, who's the program director at UK for the AHEC, we have collected data. We have not collected the best data until FY23 when we got on that statewide approach. But we have collected data in the past, and it's being analyzed right now. Until recently, we haven't really had the manpower or the skill sets to analyze that, but going forward, we will. So hopefully, we'll have that answer, a more complete answer for you. If you have questions about specific programs, for example, we have a lot of great data on our STEPS or pre-med programs on how many students who went through those programs are still in Kentucky medical schools. We're happy to get that for you. I don't have any of those numbers memorized. I don't know if anyone else has those numbers memorized, but you have our contact info and don't hesitate to reach out, and then we can get that information for you. Are we doing enough? No, we're not doing enough. We're never doing enough. But let me put it this way. We do have a small separate funding pool that is just for MCAT prep materials, which is why we have the data for that. However, our pre-programs are open to all the pre-students. And when I say pre-students, I'm talking pre-PA, pre-med, pre-dent, pre-optometry. We've had some pre-chiropractor students in our programs. And so, like, the resources, obviously we're not going to get MCAT prep materials for anyone who's not pre-med, but whatever their entrance exam is, that's where a lot of the funding goes to. So, for example, PA students oftentimes have to take the GRE, and we'll help them with securing GRE prep materials. The mock interviews, the personal statement reviews, the shadowing, we do those for all students. It doesn't matter what discipline they're planning to enter. Yeah, so that's just the one program, but yes, and the name may need to be changed. Like I said, there's a small pot of specific funding to purchase MCAT prep materials, which is why that goes directly to that program. That'd be great. Yeah, and if you go onto South Central AHECs, you'll see that mock interviews, personal statement reviews, shadowing is open to all students. And I know I can speak when we go to all of the, at the beginning of each semester, when we talk with all of the pre-health advisors at our various institutions, for example, at WKU or at Campbellsville, Lindsey Wilson, those are the three that are in our area. We even provide them with little business cards that they hand out to students that say, ready for your, or got an interview invite, contact the AHEC office to schedule your mock interview. This past week, pre-pharmacy students must have just gotten their interview invites because last week was packed with pre-pharmacy students coming in for their mock interviews. So we probably can do a better job promoting it on our website, but we definitely make the students and the advisors aware of it at our institutions.
And all of our AHECs do have working relationships with our colleges and universities. Ours specifically, we have a physical presence on EKU campus. We work very closely with our community college systems. I know the others do as well. And I believe, Missy, you had a comment to this.
Yeah, we have the MCAT prep program that's statewide funding, and that's a allotted amount of money. But our AHEC office has a separate funding for pre-health professions. So we do offer the DAT, the PCAT, the OAT. We offer the same exact program for the pre-health profession students as we do the pre-med students. And not all AHECs have that funding. That was just something we had before we got the MCAT prep funding. We were already doing that. That just gave us an additional funding for the MCAT prep. So basically the MCAT prep, that's where all my MCAT students' money comes out of, and then my other account is where all the other students come. I think we had 17 total this past year of MCAT, GRE, DAT, and OAT. I know those were some of the ones that stand out as far as students go that took those prep programs with us, and they're all offered at a very discounted rate. So they get the mock interviews and the shadowing, everything just like the MCAT. So.
We don't all call it STEPS, so it's not.
Yeah, that is an acronym that is specific to, I know Mike's AHEC uses the acronym, and I believe Northeast does as well. So we still have our own unique program names, some of us, but yeah. Any other questions out there? Yes.
So at our facility, we're currently hosting a group of AHEC students that comes once a month, like to do different tours throughout our hospital. And they just came this like 2 weeks ago. And I know from a nursing perspective, we talked to them about our 100% like tuition, pretty much our facility. If you come, you work 2 days, 100% of your tuition. Are you all going around to all healthcare facilities to make the students aware of what different healthcare facilities are offering as far as tuition reimbursement or tuition, payments for schooling? So I think that's a big thing.
Well, I can't speak for everyone here, but I know that each AHEC region, we all have working relationships with our hospitals and other healthcare entities. And we work very hard to come alongside them and see what their needs are, and we try to connect students. Do you have anything specific?
In Northern Kentucky, we have 2 programs where we invite St. Elizabeth healthcare professionals to speak to students about tuition reimbursement. We have the HR department coming. So one way we do it is through the health career summer camps, and we have different healthcare professionals speaking about their job outlook and the different opportunities that the hospital offers. And there is another program that is called the Health Career Explorers program, and we take the students into the hospital once a month and different departments, and they learn about the schooling, and we have at the beginning of each class, we have the professionals speaking to them about a case study that we develop, and then all the healthcare professionals that need to take care of that patient. So we emphasize also the interdisciplinary work. And again, going back to your point, yes, we do have opportunities where the students learn about the tuition reimbursement, and then job opportunities, shadowing opportunities, volunteering. Those departments participate in our programs.
Yeah, I was just going to say, there's all kinds of opportunities that we do throughout the year, whether it be career camps, expos, clubs. We really try to partner with our healthcare facilities, and we invite them in to share that information, what they have to offer with the students. So another point I want to make also, today we've talked about the funding that we received and the expanded programming. However, AHEC has been very involved in student rotation placement for years. And so we are very intertwined with our healthcare community, whether it be identifying, finding, recruiting preceptors to pay it forward, to educate our students. We have really good partnerships with our healthcare community. Our summer camps, I've got UK Center for Excellence in Rural Health in the room. We have been partners for years for summer camps and all of the programs that they represent. Talking about medical lab science, Bianna, she comes to all of our expos. She participates in our health career camps. We try to provide so many opportunities for these, various programs to be presented. However, our healthcare community is also very intertwined in those opportunities as well.
And I would just add, if we are not partnering with your entity yet, or you would like us to bring high school students into your facilities, or pre-med, or pre-nursing, or clinic, whatever clinical students you want, let us know, because we have the students. We just need the facilities.
Yeah, for example, this past summer, we hosted 6 summer health career camps. We did one in Bell County, we had one in Floyd County, we had one in Clay County, Breathitt County, Perry County, and Harlan County. And when I say we hosted those, we have to have space. We have to have a place to do this. And so we call upon our partners. Those partners are, like, for example, like I said, UK Center for Excellence in Rural Health in Perry County, also Hazard ARH Regional Medical Center. Clay County, Advent Health, their hospital. Breathitt County, Kentucky River Regional Medical Center. Those partners have opportunities to share with the students what they have to offer in those given experiences. However, we have multiple other opportunities as well.
All right, I think time is up for us, unless anyone has any dire questions. We'll be around, and you have our contact information. So seriously, if you guys want to partner, let us know, because we want to always expand our partnerships.